Probably this dog was implanted a little bit too late, re-implanted a little bit too late, and therefore, at the time where the testes probably were already increased in size, and he got another flare-up effect. So that's the danger of waiting too much to reimplant a dog if you want to implant all his life. There are two possibilities. Either you reimplant when the testes are still very small, so you know that the dog is still castrated medically, so you have no risk of getting a flare-up effect. Either you implant when the testes are becoming bigger. It's a mean of implanting not so often, but the problem is that you will get a flare-up effect. In most dogs, it doesn't matter, but in some dogs it may create a little bit of nervosity or whatever. So that's why personally I prefer to reimplant the dogs when they are still inhibited, so just after 6 months. So there is a reversible effect on hormones after a successive reimplantation. So two alternatives: when the testes re-increase in size, or every 6 months, and with the 9.4 every year. Now you have in France, and I guess in other countries, maybe it's the case for some of you, some computing system, exactly like vaccinations, automatically every 6 months or every year there is an email or letter generated by your computing system sent to your client and telling your dog has been implanted 6 months ago, it's the time to reimplant the dog, and therefore the owner doesn't miss the time of implantation. So of course it's a complete cultural change, because in the past surgical castration was the gold standard, and progressively it's going replaced by medical castration. And you have to consider that most dog owners, they don't know that medical castration exists. So if you don't offer them, if you don't speak about it, they will not ask you because they don't know. But what I see with my own consultations at Paris Veterinary College is that when you speak about the two alternatives, some of the people will prefer medical castration for all the reasons we already stated. And this is the data I had from the academic year 2011-2012. So all the dogs, of course, all the owners came initially for surgical castration because they didn't know that medical castration exists. And 15 out of these dogs were implanted, and the owners of these 15 dogs were so happy with the result that they asked for reimplantation. So they didn't ask for surgical castration, they asked for reimplantation, and it's still going on for reimplantation of these dogs. Do you have any questions on this? So now I'm going to speak about two off-label uses of suprelorin. So it's Balkan en français, in French, with a Boston. It's a French breed. I don't know if you know this breed. Actually, the Bos, big dog, and it came for surgical castration. It's a woman who is living very close to the vet college. So the problem of this lady is that she's divorced. She's living alone with 2 young children. And the dog, once he has passed the puberty and getting older, became very aggressive towards the other males, which was a problem for her when she was walking the dog outside, because she's quite a small woman with this big dog trying to pull her to attack the other dogs. And what really made her think that she wanted castration is that when she was feeding the dog, sometimes when the children were approaching the food of the dog, he was grunting. And so of course she was very scared for her children. So that's a very tricky case. Because, of course, the owners, they just know that surgical castration exists. And when they speak with their friends, their neighbors, they say, oh, you should castrate your dog. It will solve the problem. So, what do you think about the effect of behavior of surgical castration? Would you do this? Who would do this? This time, nobody, and I agree with you. Because we know that when we speak about hypersexualism, aggressivity, it's not really aggressivity, but I don't want to say a term because I know that behaviorists, maybe some of you are behaviorists, they are very strict on the terms that have to be employed. But in this kind of case, it's always very tricky because we know that most dogs will be significantly improved in their behavior by surgical castration. But unfortunately, a very few percentage of dogs will be increased in their bad behavior. And that's a very big problem. There was a publication by Anderson and collaborators in the Journal of European Companion Animal Practice in 2002, in which out of 48 dogs that were surgically castrated, two dogs out of 48, so it means nearly 4%, were more aggressive after castration. So it can be a problem. Imagine, it's irreversible, you castrate this dog, and 2 months later the dog attacks one of the children. So it will be difficult for you to explain to the owner that you have chosen the best solution. Maybe now we are in a society where vets are very often put into court. Maybe the lady could even put you into court. So this is a problem. About 1 month ago, I had the same case, Dogo Argentino dog living with a young couple with a baby. And the dog was beginning to be a little bit strange behavior with the baby. Of course, the best would probably be to separate the dog and give him to another person. But surgical castration can be a little bit questionable. So, anti-androgens, compounds like, for example, megestrol acetate or chlormazepine acetate. Have you tried these compounds for this kind of behavior? In fact, in France, some vets are using these compounds, these progestin compounds, to see if it works. And if it works, they say, okay, it works, I can castrate the dog surgically because it will work. And they make a mistake. Because these anti-androgen compounds are not at all predictive of which behavior you will get after surgical castration. They have a central effect that can be compared to a neuroleptic effect, and they block the dopaminergic T2 receptors, and they have a calming effect. So in some dogs, you may have a very good effect of progestins, but not at all the same effect when they will be castrated surgically. So it's not predictive of what you will obtain. And furthermore, well, it's not important for this dog, but there are questions about the use of progestin on altering the semen quality, so making the dog hypofertile or even infertile. So the question was, of course, and there were many reports in previous congresses, can we use suprelorin as a predictor of what's going to happen after surgical castration? And the first study to be released was done in Utrecht University by our colleague Geoffrey de Gier, who did in fact a study in 2 steps. First, and it's the black bars, there was a pilot study just asking people on the phone after implanting their dog and asking if they were happy with some of the behavior of the dog, mounting the other animals, the females, urinary marking, roaming, intermale dominance, playfulness, is playing more or not, and preputial discharge that they may have. And then they did a second study, seeing the dogs very regularly, on comparing surgical castration, that's the first two bars, and medical castration on this aspect. So this is the percentage of dogs that are improved by the process, and the second bar is the dogs that are improved by more than 50% on this behavior. And you see that except, and it was not significant, but except for mounting, in which surgical castration was a little bit better in the effect than supralorine, in all other behavioral aspects, there was an identical effect of surgical castration or medical castration. So from this, Geoffrey de Gier concluded that the implants containing 4.7 milligram of desloratadine probably accurately predict the behavioral changes that you can get after surgical castration. So if you hesitate to castrate a dog and put an implant, if it works, then you know that surgical castration will work. So this was confirmed by a second study of Geoffrey de Gier at the World Congress in Vancouver 2 years ago, where he had the same effect on behavior on another study, and therefore, and even in this study, the dogs that were implanted with supralorine had a tendency to play even more than dogs that were surgically castrated. Of course, there are two aspects that we have to take into consideration in this kind of dog. First is the flare-up period. So of course, there will be an increase of testosterone. If the dog is already a little bit at the limit, maybe it's better to send the dog away for about 2 to 3 weeks, give it to the grandmother or send it to the countryside or I don't know, or but avoid the dog during this period. And of course, if the dog becomes really bad during this period, or if the owner changes his mind, you'd better put the implant in a place where you can remove it easily. If you implant a dog in the interscapular region, of course you can see the implant by ultrasound, it's quite easy, but to remove, it's not so easy. So what is done by most authors is to implant the dog in a place where you can see very easily the implant and feel it under the skin. And what we are doing is that we are implanting in Paris dogs just behind the umbilicus, under the skin. You don't need a sedation for this in most dogs, and you will tunnelize the under the skin and put the implant. I don't know, Marianne, you are implanting dogs like this also? Yes. And in fact, I know that in Germany very often they don't use this, they implant in the interior of the rear back. I've seen some dogs with 3-4 implants, because the implants are not resolving, they are staying intact even after 2-3 years, so you can feel them very well under the skin. And but at least what is good is that if you need to remove the implant, you just make a little incision and you remove the implant and it's finished. So what happened in this dog? The testes disappeared after 40 days. The testes, no, decreased, disappeared. And it worked very, very well on behavior. So the woman was very happy. We could have castrated the dog, but as many owners who have implanted their dog already, she wanted to reimplant the dog. She was reimplanted with 4.7 once and then with 9.4. You have some questions on this off-label indication? Yes?
Not precisely about that, but I was wondering, is there any data about how supralorine affects testicular tumors?
To my knowledge, there is not. So,
already predictive of whether it increases the risk?
you mean when a dog that has already a testicular
No,
tumor?
for example, is there any idea if it decreases or increases the risk of getting, for example, septic cell tumor or something like that?
To my knowledge, nothing has been published on this. But I would say that because Australian people have a long experience of this compound, if there were long-term side effects, probably we will nowadays begin hearing about them. Because, but in fact, you may have the same effect as surgical castration. You know that surgical castration, of course, you don't remove the testis, but you have no stimulation of the testis anymore. So we could think that there may be a prevention. Concerning other genital organs like prostate, we will speak about the break about prostate. There is still this question about the potential increased risk of prostate cancer in castrated adults. So really, probably this is the same with supraglobin, but unfortunately I cannot answer. And there is a study that has been shown at the European Congress last year in Toulouse, in France, on behavior also, but this time on behavior problems, dogs having really pathologies using supraglobin. But this is something that I'm not a specialist, so I will not prefer not to speak about this. So, this is an off-label use of supraglobin also, and probably this you had some people coming to see you and asking for implantation. It's a very special category of owners. It's cat breeders. Did you have cat breeders coming to see you for this? Some of you, can you raise your hands, please? Yes. So cat breeders, they are on the internet all the time. They know exactly what happens everywhere. Sometimes they assimilate it more or less right, but and they all know supraglobin, all of them. The problem is that, and that's the problem with all cat breeders, because most cat breeders are breeding at home. They have 1, 2 males and some females, and after a while, the males are marking, and it's terrible. The smell in the house is terrible. So they would like a solution with keeping the fertility of the male, but suppressing the smell. So that's, of course, we say in French that you want to have the circle square. You know, it's not very easy. So this cat was living in a little household cat family, cattery, with 4 females and 1 male. And as often with pure male cats, they are in the first part of their life, they go to shows, they are not mating, but if they win many prizes, then they will be put into reproduction. But the problem of this cat is that he was marking a lot. First option, of course, is surgical castration, but it's irreversible. And second option is progestins. So once again, megestrol acetate, for example. And the effect on urinary marking, probably you have noticed by yourself, it's not very good. And furthermore, this cat is intended for reproduction, and when you use steroid hormones, you never know how the organism is going to react. So maybe you can have a further infertility. Probably you know that purebred cats already don't have a very good quality semen most of the time. There is a lot of teratospermia in cats. So if you use steroids, I would not be sure that the cat will remain very fertile. So could we use supraglobin in Oscar, in this cat? Indeed, we begin to have quite many papers. The first 2 papers were presented, one in a congress in the States by Stefano Romagnoli, and it's our colleague Sandra Gurlik-Pesch probably you know her, very, very wise and serious colleague. She was in Gießen in Germany, now she's teaching in Copenhagen. And she did quite a lot of study of using sucralorine in cats, in females and in males. And there were more or less similar results in the two studies. And in 2014, she just published a review on the use of these implants in cats. So there are no effects on the biology side. And when we look at the testosteronemia, after implantation of a 4.7 implant, it's a little bit different in cats than in dogs, in the sense that in all cats, testosteronemia will become basal, but it's a little bit slower process. There is no per se a flare-up effect, but the testosterone is getting down slowly, and you see to get 9 cats out of 10 to have a basal testosterone, it took nearly 3 months. So it's quite long. It means that some of the cats can remain fertile for maybe a long period after implantation before they become medically castrated. What happens? Of course, you will have a diminution of the testicular volume, exactly like you have in dogs. And what you can check also in cats, it's very useful to see if the cat is downregulated, if the implant is still active, if you want to reimplant the cat. You can look at the penile spines that are on the tip of the penis. You know that they disappear when the cat is surgically castrated. It's the same when you put an implant. These penile spines disappear. So what is now, sorry, it's in French. It's changing of behavior. I don't know why it's in French. So you have here the data from Stefano Romagnoli, and in red you have the disappearance of this behavior. And you see that for urinary marking it works very, very well. Most cats, after implantation, they don't mark anymore. So it's what the owner expects. They are less aggressive towards other cats. Of course, they lose their libido. The problem, of course, that they have an increased appetite. So if you are not careful, they may put on weight. So that's something, especially if you reimplant the cats over the years, you have to be careful about this. At the moment, I would say that the major problem of male cats being implanted with sucralorine, maybe you had this problem, maybe with the cats that you implanted, is that the cats are inhibited for a long period. In average, it's about 1 year, and in this very recent publication by Sandra Pesch, it was even a little bit more than 1 year in average. So that's a problem, because sometimes the owners have finished their show program of the cat. They would like the cat to reproduce, but is still under inhibition. So this is something you have to tell the owner. I think it's important. And of course, after testosterone comes back, then the spermatogenesis comes back very quickly, and there is a reversibility of fertility, as it is the case in dogs. So in Oscar, after implantation, it works quite well. He had the disparation of the penile spines, and there was a spectacular effect on urinary marking, and also the male odor was not so strong. So the